Bismillahirrahmanirrahim. Assalamu alaikum. Hi guys, welcome to my YouTube channel Psychologist. My name is Yaseen and I'm a psychologist by profession. In my last video, I was talking about that what's the difference between psychosis and neurosis. Today, in this video, I'm going to start psychotic disorders, that how many psychotic disorders we have. In this video, I'm going to start from bipolar disorder. There are two kinds of bipolar. One is bipolar 1 and one is bipolar 2. In this video, I will discuss about bipolar 1. Bipolar 1 consists of two symptoms. One is mania and the second one is depression. There is one baseline of our mood. When we above from that baseline, so we go to mania. And when we below from that baseline, so we go to depression. So in bipolar, sometimes we go to mania and sometimes we go to depression. These two episodes going on in bipolar 1. Let me talk about depression. Depression is a thinking disorder that affects our mood, behavior and emotion. I have already made video on depression. You can see that video. Let me revise the symptoms of depression. There are several symptoms of depression. In depression, a person feels sadness consistently. A person lost their interest. He or she goes to isolation. They lost their social interaction. They lost their concentrations. They become hopeless and helpless. They lost their sleeping routine. They lost their eating routines. And when depression is severe, so the suicidal ideation comes in their mind. People commit suicide because of depression. Let me talk about mania. Mania, it is a common symptom of bipolar disorder. It's a psychological condition that causes a person to experience very intense mood, hyperactive and delusion. There are several symptoms of mania. In mania, a person who becomes too much talkative. Like in past, in normal state, they were not able to talk too much, but in mania, they talk too much. In mania, a person who becomes sleepless, they are not able to sleep, but after 2 hours, 3 hours sleep, they feel fresh. In mania, a person who becomes violent and aggressive, they abuse others, they abuse the right of others, they starting abusive language. In mania, a person who becomes hyperactive, they are doing a lot of work, they have a lot of energy. In mania, a person has delusion and hallucination as well. Hallucinations mean that they are experiencing some kind of voices without the existence of any stimuli. In delusions, a person make false belief because of thinking too much. Like in mania, there is one delusion common, that is delusion of grandiosity, where a person who make believe on their self that I can do each and everything. I'm a Spider-Man, I'm a Superman, even I can jump from the roof. So these are basically some symptoms of mania. If someone who experience it, and when it take 1 week, so psychiatrists diagnose someone with mania. So in bipolar, first of all, a person goes to mania episode. After some day, even it can take some weeks, it can take some months. So after days or few weeks or few months, a person goes to depression, where he or she feels sadness, loss of interest or different symptoms of depression. Let me talk about the prevalence rate of bipolar 1. The prevalence rate of bipolar 1 is 0.3 to 1.5%. 1.5% people are suffering from bipolar. So these are basically some things related bipolar. If you are experiencing any kind of symptoms such as mania and depression, then you should talk to psychiatrist, because in bipolar medication also play important role. So you need to visit to psychiatrist and psychologist as well. So I hope that you got something from this video. If you like this video, so please like it, subscribe my YouTube channel and share it with your friends. See you in next video. Thank you so much.